I'm Kevin Breen, and in this video I'll explain that marijuana should be legalized because it's not that dangerous, it can have positive effects, prohibition itself causes problems, and people have the right to do what they want with their...
Kevin, have you seen my weed?
Yeah, I'm using it here for visual aid. Anyways, people have the right to do what
I'm about to go, so I'm just gonna, I need to take that.
But I'm using it as a visual aid. I'm making a legalization video. What am I gonna make a legalization video about if I don't have...
Dude, maybe that.
Huh.
Peace out.
Hi, I'm Kevin Breen, and in this video I'll explain that all illicit drugs should be legalized because they're not that dangerous, they can have positive effects, prohibition itself causes problems, and people have the right to do as they damn well please. Heroin, cocaine, bath salts, meth, popcorn. That's actually just popcorn. It's good. LSD, magic mushrooms, the list goes on. There are more illegal drugs than you can shake a stick at, and I should know. I even have this special stick with a certified drug shake capacity of 30% more than an ordinary stick. And look, it doesn't even budge. But what if drugs are inherently dangerous to people? Take an average ordinary guy like James. So what happens if James decides to take some drugs? Well, first of all, this happens to his brain. Then he starts beating his average ordinary wife, Mary, and their 2.8 kids. And then he gets arrested chewing a homeless man's face off and spends the rest of his life in a mental institution thinking he's a glass of orange juice.
The average drug user does not beat their wife, they don't chew a homeless man's face off, they don't think they're a glass of orange juice.
But he does fry his brain, right?
No, no.
God damn it.
We all hear the story. A normal person does drugs, turns into Mr. Hyde. The problem with that story isn't that it's a rare occurrence, it's that it never happens.
So what really happens to James when he takes drugs? Probably not much. Drug use does appear to be correlated with schizophrenia, but population studies have found that schizophrenia rates usually stay at about 1% despite rising and falling drug use. And this is true for countries with extremely low rates of drug use, indicating that schizophrenia makes people try drugs, but that drugs don't cause schizophrenia. But are schizophrenics the typical drug user?
The average drug user is more affluent and more intelligent than the general population.
The UK's National Child Development Study found that people with higher IQs were much more likely to use drugs than people with lower IQs. But if James does drugs, will he become a hopeless addict? Probably not. Heroin and cocaine are widely considered to be the most addictive recreational drugs, but only 7% of the people who report having tried crack say they've done it within the last month. And Dr. Erwin Haas, physician and former medical director at a rehabilitation unit for soldiers during the Vietnam War, said that most heroin-using soldiers never even had to go to rehab because they were able to simply quit cold turkey when they had upcoming drug tests.
There must have been tens of thousands of these fellows who got themselves off of heroin. They stopped using it maybe a week or two before leaving, and when they got to the exit points to the borders, their urine tests were clean and they went back to the United States. And so far as I know, very few of them went back to using heroin.
And the ones who didn't do that had a fairly easy time quitting.
They came in, they were crabby, they little disgruntled looking. By the next day they were eating. By the third or fourth day they were just fine.
Also, illicit drugs have positive effects, just like prescription drugs.
DNA has been shown to treat post-traumatic stress disorder.
Heroin is extremely effective for pain control.
Both LSD and psychedelic mushrooms are effective in treating clinical depression.
Cocaine is the basis for all of the novocaine, lidocaine drugs.
Okay, so maybe illegal drugs aren't that bad. But if somebody gets arrested for it, only they have to deal with the consequences, right?
Prohibition creates artificial consequences for the user and society as a whole.
Portugal decriminalized drugs over a decade ago, and they saw a drop in drug crime and heroin use. And in the Netherlands, where marijuana is decriminalized, they consistently see usage rates of about half that of the United States. And even if it wasn't, who cares?
It's really, among adults, the individual's business. The busybodies out there really don't have any moral basis for trying to interfere with what I do to myself.
What seems to be left out of the drug prohibition argument is that people like to do them. When we talk about what beer we like to drink, we don't talk about which one has reduced negative health consequences. We talk about what we like. And that's the sort of mentality we need to start extending to these illegal drugs.
So there you go. In under 5 minutes, illicit drugs should be legalized because they're not that dangerous. They have positive effects for most users. And even if that wasn't the case, the drug war causes more problems than it solves. And a person who wants to use drugs has the right to do as he damn well pleases. And only he should take the consequences.